Hello. All right, welcome to my talk about poisoning. Well, like hacking, poisoning in real life is not like you see in movies and TV. I mean, the antidote within 17 seconds. There's only a few drops. All right. Whew. That's better. It would have been insta-death if I hadn't taken that. It's actually kind of hard to see my notes. Well, I'm going to get into a little bit about how poisons really work. Sorry, my keyboard is. Sorry, a little bit of technical difficulty here. All right, I'll do it this way. All right, I'm a pharmacist, and I like toxicology. I did a couple rotations, one at a poison center and one at a hospital. And one thing I like about toxicology is talking to people. If I talk to a normal person and I say, well, yeah, if someone were to have a bunch of rat poison, they'd be okay for a few days, really, but then they'd start to have internal bleeding, and they'd get anemic and low blood pressure, and if they survived the hemorrhaging, they would need vitamin K for several months. And a reaction from a normal person might be, why do you know that? And it's just strange because it's like, why? Why do you know a certain piece of knowledge? But in toxicology, I don't get that question. A question I do like when people ask why present at a hacker conference. One is because, a body is a biochemical system. There is an analogy of hacking because chemicals can hijack these chemical processes or change them. So basically, chemistry can hack the body. Although more importantly, I like talking at Hope. I've done it a couple times now because you guys are really interested in knowing how stuff works. And it's really the knowledge that is important, I think. Oh yeah, and I'll introduce. This is my favorite hacker. It's a cold virus because it attaches to receptors in your nose and throat, which makes snot, and the snot is full of viruses, and then it spreads around. So it hacks to survive. And so really, it's about understanding how a system works, a biochemical system of the body. And I'm going to go into some more examples. Starting generally, there's perception versus reality, obviously. You don't have insta-death from poisons. A lot of times there's not an antidote, or there will be an antidote, but we won't use it to treat. And you don't really get that instant painless death that some people might imagine. And a lot of how poisons actually bring down the system has to do with homeostasis, which is basically the balance of the body. And I don't mean some sort of metaphorical, balance. There's very specific parameters that the body is always keeping itself within at any given time. In response, the environment changes, but the body needs to stay the same, and yet be flexible to changes. And I've listed some things that keeps in balance, including even water. If you have too much water, it can become toxic because too much of it gets into the cells and they can burst. So homeostasis is very important. One way that poisons can disrupt that is by damaging certain organs, especially the liver and kidneys. The liver is involved in a whole lot of things, from glucose to clotting, to the water balance, digestion, detox. So Tylenol, there's a perception that maybe, if you take the whole bottle, you might, go to sleep and just never wake up. And this couldn't be farther from the truth. There's actually a delayed toxicity with Tylenol. Paracetamol is another name for the drug, acetaminophen. It's in the top left there, and it's metabolized into different things. The one on the bottom left, NAPKI, is a toxic metabolite, and that damages liver cells. Thankfully, our body has glutathione, or GSH, which cleans up the NAPKI normally. But in a large overdose, there isn't enough GSH, it gets depleted. And so sometimes, someone will take a big overdose of Tylenol, and they'll feel okay, the first day. They'll be like, oh, that didn't work, I changed my mind. And then the second day, they might start to feel a little sick. And then by the third day, they're really sick and they end up in the hospital. And by that time, the antidote, which I'll talk about in a minute, doesn't have much of a chance to work. And so they're on the liver transplant list in the ICU, on supportive care. It can get messy. The antidote is called N-acetylcysteine, and basically it promotes the production of GSH, and it's most effective before the damage is done. So, did any of you go to the biohacking last night? Cool. When they talked about printing out organs and such, I think the liver would actually be a good one to start with, because it can regenerate very well. And if at the hospital you can get the person through, if you can keep them alive and keep them from going into multiple organ failure after this overdose, the liver will actually recover quite well. Another thing to deal with is the kidneys. So if you ever wondered about antifreeze, it's got some toxic metabolites. Again, it's not itself that's toxic, it's the metabolites, and they crystallize in the kidneys, doing damage. And it's got an interesting antidote. Good old ethanol. Basically what happens is the antifreeze gets metabolized by the same enzyme that metabolizes ethanol. And so the idea is, or used to be, overwhelm that pathway, and you get them drunk enough, and they won't get toxicity from antifreeze because it'll eventually get excreted. And but there are a lot of side effects, because you have to keep them at a blood alcohol level of 0.1 to 0.15, which is, on average, maybe like slamming 5 shots. And you have to keep them at that level for a long time until all the antifreeze is gone. It could be, a few days. So thankfully, we do have a drug now that works as an antidote as well. It inhibits the enzyme without actually dealing with all those side effects. So another way to bring the system down, obviously you need to breathe and to use oxygen. So some examples are drugs that slow down breathing, like opiates, heroin, morphine, benzodiazepines like Valium. There are things that stop your breathing, like curare, tetrodotoxin, which is the fugu fish toxin. They basically paralyze you, and that includes your diaphragm. So if you just stop breathing, obviously stop getting oxygen. But artificial respiration will help keep you alive in that case. There are some that interfere with the availability of oxygen, carbon monoxide. Basically in your blood, oxygen's carried by hemoglobin, but carbon monoxide will bind to that and displace the oxygen. It'll kick it out. And then there's ones that interfere with respiration on a cellular level, and that's cyanide. On a cellular level, this graph looks kind of complicated, but you can think of it as a hydroelectric generator, except with electrons instead of water. There's a flow from left to right here of electrons, and on the right, that ATP synthase over there, it actually turns physically and generates the energy for your cell. Cyanide will inhibit the complex 4, the purple one, and basically stop the flow. So it stops the generation of energy. And carbon monoxide and cyanide are called the toxic twins of smoke inhalation, because whenever someone's in a fire, they're both a big concern. With carbon monoxide, you can give the person lots and lots of oxygen in an attempt to get some oxygen on that hemoglobin. If you do that for cyanide, that's not going to work. But thankfully, we have vitamin B12 in its different forms, hydroxycobalamin. You can give that and it'll bind up the cyanide and turn it like the cyanocobalamin is not toxic at all. So moving on to the heart, this is River Phoenix. I'm just going to use he's an actor who overdosed when he was 23 back in 1993, and his the cause of death was acute multiple drug intoxication. What happened was he went to a nightclub and he was speedballing, apparently, which is a mix of heroin and cocaine. And he was feeling sick and also took some Valium. And he collapsed outside the club and was having seizures. When the paramedics arrived around 1:30 a.m., they started giving CPR. He had already flatlined. And I'll make a note about CPR. It's actually, you only really give it when a person is in very bad shape. They're not breathing and they've got no pulse. And it's really the act of, again, it's not like TV where you just like gently press on their chest. You have to really press down because you're physically squeezing the heart in a desperate attempt to get blood to circulate and to keep that person's brain alive by getting some blood into the brain and the rest of their body when their heart can't do it. So the success rate, like you need to do it, but the success rate is very low, and it wasn't successful in this case, obviously. To start the heart again, you need either some drugs, and they're shocking, but you don't shock, you can't really get the person's heart started with a shock if it's stopped. So like, unlike in TV, if their heart's not beating, you can try to CPR and certain drugs, but it's not likely to be successful, unfortunately. He arrived at the hospital at 1:34 a.m. and was pronounced dead about 20 minutes later. So the autopsy found morphine, which is a metabolite of heroin, cocaine, diazepam, that's a Valium, metabolite of marijuana, pseudoephedrine, and ephedrine, which could have been contaminants in the cocaine or cold medication. So there were a lot of drugs in the system, and the levels of cocaine and heroin in particular were both very high, so they ruled it acute. They're like, we don't know what killed him. But looking at it as a toxicologist, as I talked about before with the breathing and respiration, heroin and Valium, if they would have been toxic, they would have killed him by slowing his breathing. On the other hand, his heart was stopped and he had seizures. That's very typical of cocaine and stimulants. So that's really what killed him. Interestingly, the Valium is one of the things he might have been, a type of drug he would have been treated with in the hospital if he'd survived longer. It was actually the right thing to take, but it was too little. The cocaine was way too much for whatever small amount of oral Valium he had. Another toxicity that he wouldn't have had to worry about back in '93, but is more of a problem now, is Levamisol. It's a drug that is used against worms, and it's in a lot of the cocaine in the U.S. As of 2011, it was in over 80%. I couldn't find a more recent number for that, but a lot of the cocaine, it's actually cut before it comes into the country, and it seems to have some enhancing effects on the cocaine. Unfortunately, it can cause some heavy-duty immune system failure and skin toxicity. I could have found some illustrations for the skin toxicity, but they were pretty gross, so I'm with the XKCD guy. I'm just showing you a squirrel. So, nervous system toxicities. We've got, with the case of stimulants, you've got the sympathetic nervous system, which is the fight or flight, and that's activated by stimulants. And you've got the parasympathetic nervous system, which is the rest and digest. You don't hear about that as much, but it's very common to see these toxicities. Anticholinergic, because it involves the neurotransmitter acetylcholine. Tylenol PM, we already talked about the acetaminophen, the Tylenol part. So here we're going to concentrate on the PM, which is diphenhydramine, also sold as Benadryl. And if you were to take the whole bottle, you would get, again, there's a perception of like, oh, Tylenol PM, if I took the whole bottle, like, you take a little bit, you fall asleep. If I took the whole bottle, maybe I'd fall asleep and never wake up. That's not what happens. You get anticholinergic toxicity, which is the same kind you find in deadly nightshade. There's basically a bunch of different symptoms that basically have a lot to do with having very dried up, few bodily fluids. The skin is really hot and dry and itchy, and you're really heated up. There's delirium, as in talking to people who aren't there. That's a characteristic. And it can lead to, so hyperthermia, being too hot, and seizures and coma, and an overdose. And the treatment is generally supportive care. That's a treatment for a lot of stuff. There actually is an antidote, but it's very short-lived and is used more to diagnose the toxicity than it is to treat it. It's called physostigmine. Reverses the effect, but again, it wears off really fast. So usually treat whatever symptoms are needed in the hospital to keep the person alive, keep them cool, until their body can clear out the drug. Another common one, often you see these two together because there are a lot of antidepressants and things that have both kinds of effects. Serotonin toxicity, or serotonin syndrome. It's basically a special type of the nervous system going haywire with too much serotonin activity. There's a lot of overactive reflexes, tremor, bowel sounds, and also altered mental status, not quite the same as the delirium you get with the anticholinergics. And hyperthermia is a real problem because the person's moving, like their muscles are shaking, and after several hours of that, there's a real chance of muscle breakdown, which also can cause kidney failure. And that's in addition to the damage that can happen from hyperthermia. And I mean, it can basically happen from any combination of two drugs that affect serotonin, although it's dose dependent. So you see it a lot in overdoses, but not normally, not a lot in normal treatment. Yeah, in this case, again, there's an antidote, but it's oral, and if someone is shaking, a lot of times if they're really bad, you don't want to give it because there's a chance they might not be able to swallow it properly. And so usually IV benzodiazepines are used to calm the body down and keep people from moving. In some cases where it's extreme, you have to put them in a drug-induced coma for a while, and you maintain their breathing and everything. And again, it's keep them alive until the toxicity, until their body clears out the poison. I also want to go over a little bit about acid and bases, and also a special case. Usually acids and bases, like Drano, they'll be corrosive, like on direct contact, because they're directly damaging to cells, and you won't get a systemic poisoning. But as shown in this still from a popular TV show, there's one called hydrofluoric acid, and this would be probably a toxicologist's nightmare to see this in any chemistry lab, 6 jugs of the stuff, because it's a weak, like as far as acids are, it's weak. It's considered weak, but it's special because it can cause systemic toxicity. That fluorine is basically the problem, and I mean, it can cause burns, delayed burns, like they don't necessarily show up right away, but like a day later they can show up. And I'm not going to show some more serious ones. You can look them up yourself. Really interesting thing, the fluorine part of hydrofluoric acid will absorb. It can eat through glass because it's not the acid, it's the fluorine. It'll attack the silicon. And, huh? Oh yeah, it's used low concentrations to etch glass because it's special. Other acids won't be able to do that. It also loves to bind to calcium, and so it could eat through bone, and it can absorb in your system, and it can bind up the calcium, and that's what can cause systemic toxicity. I mean, it takes very little, like if you were to ingest it, it takes very little to do a whole lot of damage. Even just a 5% solution, just a few ounces could be fatal and result in cardiac arrest 6 hours later.
Garbage man that you walked about 10 years ago that died rather horribly that way. He took a bunch of garbage that he lit a compactor at the truck, and it was a big jug of it in there. And the jug squirted. He did not live, obviously.
Yeah, so there was a garbage man who, there was a jug in there and it squirted him.
Yeah, covered it with stuff, basically. It's closed.
Yeah.
It was already too late. As you said, cardiac arrest is definitely a likely possibility to lead to exposure. Not that.
Yeah, so I mean, the thing is, it can be very toxic and absorb through the skin too, and especially if it's high concentration. If it's a 100% concentration, it can be fatal if it absorbs through 2.5% of your body's surface area, which is about the surface of the skin covering your hand. So if it covers your hand, 100% concentration, it can kill you. Because of the calcium, it takes all the calcium in your body. And so, and at lower concentrations, it's not going to be like as problematic, but it can still give you burns. The treatment is calcium, whether it's topical or systemic. They'll give lots of calcium to try to bind up the fluorine and keep you from, keep your heart from stopping. And the last example I wanted to talk about, this is actually one of my favorites because it's a more complicated toxicity, aspirin. It just seems like a lot of different things happen. First of all, it stimulates an overdose. It'll stimulate the respiratory centers in your brainstem. And that'll cause the patient to hyperventilate and breathe really fast. And the reason this is important, I'm going to go into a bit of background, is that, again, homeostasis, the pH of your blood is kept in a very tight range, and two organs actually do this, your lungs and your kidneys. And they can compensate for each other. Your lungs only take a couple minutes to compensate, and your kidneys take a few hours. But if you start hyperventilating, your blood pH, it will become more basic, less acidic, because you're blowing off a lot of carbon dioxide, which in your blood gets converted to carbonic acid. But if you were to hyperventilate for several hours, your kidneys would kick in and bring your blood pH back into, normal range. But since the aspirin stimulates that, it'll cause a respiratory alkalosis. That's when your blood becomes more basic because of your lungs. And then you also get a metabolic acidosis, which is, first of all, your kidneys will compensate. Aspirin and its metabolites are they're acidic. It also has the effect of decoupling oxidative phosphorylation, basically going back to the cyanide in the hydroelectric generator there. If you imagine that process, instead of blocking it like cyanide does, it detaches it. It's like taking the generator offline. So there's electrons still, they can flow, but they're not making any cellular energy. And that results in more acid buildup, and it causes your body to have to use other methods to get energy and metabolize glucose. And the byproducts of that, lactic acid, pyruvic acid, they also make things more acidic. And also, if you're hyperventilating for several hours and you're sweating and your body, your cells are metabolizing faster, you lose a lot of water. And then your blood pressure goes down, there's less volume there, so that concentrates the acids in your blood. And so an aspirin overdose patient, they're like that alone, that'll also stimulate them to hyperventilate to compensate for the acidosis. And so their blood pH might be in normal range, but from lab values you can tell that there's both an acidosis process and an alkalosis process going on at the same time. And so it's a more complicated overdose, and the problem is too, like when you're treating it, if you were to give oxygen, if you were to intubate, give someone a breathing tube, you set the respiratory rate, and if they're breathing 36 times a minute to compensate and keep their blood pH normal, if you've set the respiratory rate at 20, they're going to go downhill very quickly because their blood's going to go into acidosis and they're going to die. And another thing is, after several hours of this, they'll wear out. They'll wear out themselves, and they can, again, one of the things with aspirin overdose is they can just quickly go downhill after being kind of stable for a while. So if the acidosis isn't the thing, there's also the other things that can kill you. There's hypoglycemia because your cells are using up a whole lot of glucose. There's dehydration from all the fluid loss I talked about. There's electrolyte imbalances from all the stuff that's going on, and also hyperthermia can be a danger. So aspirin has a lot of stuff going on at the same time. so it has to be approached carefully. There are treatments, sodium bicarbonate, which is the same as baking soda, except they'll give it as an IV and a fluid, give lots of fluids that'll make the urine more alkaline, more basic. And so that helps the acid, the aspirin and its metabolites get excreted. And also dialysis. It's in toxicology, or Poison Center will recommend in an aspirin overdose to have the team ready, like with the dialysis, because again, someone can go downhill really fast, and if you need to do dialysis, you want to do it and have everything ready to do it. Sometimes aspirin's still deadly, even with all the treatment. And that's, if you ever wondered what happens if you drink, eat the whole bottle of aspirin, it's this stuff. So that's the end. I wanted to give you some examples of how, again, these things can bring the system down, the biological system. Hopefully I've encouraged you to think of your body, which you have with you all the time, as a system, as a machine, just like, computers, except more complicated. And again, we know how some of these processes work. And I think understanding that can only be a good thing, and in fact can mean the difference between life and death sometimes. Also, Poison Center is a really good resource in the US, at least, if you have any questions about any poisons or toxicities.